psychiatric needs, there's a stigma about it. So the more we're involved in our community and doing things with partners like Recovery Resources, the more important it is, and we can get that message out that it's okay to ask for help. There's no
Who are you and what do you do?
My name is Jeff Williams. I'm the Director of Business Development here at Creekside Behavioral Health. I've been here for 3.5 years, and my job and my team's job is to share the news in the communities that we serve of what we do and why we're here.
Okay, what is it that you all do at Creekside?
Yeah, we're a 96-bed acute care psychiatric hospital, so we care for patients from as young as 9 years old up to senior adults as an inpatient basis. And we have outpatient services too for adolescents and adults.
Okay, so both inpatient and outpatient
Yes.
services, wonderful, much needed. And you all sponsored an event that Recovery Resources is having, Thriving Through the Thicket, and I was curious as to why that was something you all were eager to do.
Well, unlike acute medical care, someone has heart disease or diabetes or cancer, they don't think twice about going to get help. Mental illness or psychiatric needs, there's a stigma about it. So the more we're involved in our community and doing things with partners like Recovery Resources, the more important it is, and we can get that message out that it's okay to ask for help. There's no shame in asking for help, and we want to get that word out. So we participate as much as we can in community events.
Yeah, we're so very thankful for it. And I think that is a huge thing that we find maybe within all communities. It's subjective for me because I live in this one, but there is a large stigma around mental health care, for sure. What do you think that's about?
I think it's just an historical thing. In the past, you didn't hear about people going for counseling even. If couples didn't get counseling or didn't talk about it at least. And why the stigma's been there, I don't really know, but I wish it weren't. And we do everything we can to normalize it and make it not just attainable and accessible, but easy to get.
Yeah, absolutely. And I've been here and I've seen the facilities, and I think it's wonderful. I wish there was more access to it. I'm sure people within your family, or at least people that have been affected by the disease of addiction as well, and it's ravaging a lot of communities in general. So I think it's really cool to see organizations and companies such as Creekside that are able to put their money where their mouth is and really show, put some action to it. Yeah, absolutely. What is it that you hope to see out of this partnership, or how do you see it growing?
I know you guys. We're not a not-for-profit, so we're not eligible for any grant funds. We give away a lot of free care. We don't charge for assessments. When someone walks in our door, there's no charge unless they become a patient. Assessments are available 24/7, 365. We never close. We're open all the time. What I'd like to see happen from your event is to just normalize. I used that word before. I think normalize the mental illness and addiction, and make people feel that there's a comfort level in reaching out and getting help, making that first step.
Yeah, absolutely. And you all have the walk-in, obviously, here in case people can walk in. Is there a phone as well people can do?
Yeah, they can call our main number, 830-8110, and then option 1 takes them straight to the admissions department, and we have a call center that will set up appointments if you'd like that, or you can just walk in without calling ahead anytime.
That's wonderful. Thank you so much for doing this.
My pleasure.
I'm really looking forward to seeing what comes of this, so thank you so much.
My pleasure. Thanks, man.
Thank you. Dude, that was great.